Hi, this is Lisa Kubota from Hawaii News Now. Could you please give us some details regarding the 3 new presumptive positive results? I believe it's 1 on the Big Island and 2 on Oahu, is that correct?
There's actually 4 new presumptive positive cases, and we are still gathering information. As far as we know right now, we know that the one on the Big Island is a traveler and is a non-resident. The one on actually both ones on Oahu are residents, and both have traveled. One from Japan, one from I have to think about this now, the Philippines. The one on the Big Island, by the way, was a traveler from the mainland state who that state still needs to be apprised, by the way, of what's of that particular traveler. The 4th one is on Maui, and that is the extent actually that we know of the cases right now, because we were just notified this morning regarding all of these cases. Actually, the 4th one we were just notified about.
Okay. Star Advertiser, Dan?
Sorry.
Lisa, we're going to handle follow-up questions after everyone goes through. So, Dan Nicasso from the Star Advertiser.
Dr. Park, which was the 4th one? What is the most recent one?
The Maui one. We were just apprised.
Thank you.
Hawaii Public Radio.
Can you guys give us an update on numbers for testing, and if we have any updated information about when private labs will be able to test locally?
Are you asking specifically about how many tests have been performed at this time?
Yeah, by the state.
By the state.
And then both, like, if you can separate out the surveillance ones from the regular ones.
Honestly, that number is getting difficult to actually report out, because we're continuing to test, and at this point we're actually looking at the clinical commercial lab testing, and as you all know, we're getting positive hits on those. We know that the clinical labs, as of this morning, I believe Clinical Labs of Hawaii had said that they had tested something like over 350 specimens at this time, and DLS has at least 300 pending. So we know that their capacity has definitely increased the overall testing capacity for tests. However, I think it is really important to for everyone to understand that we really need to stress people with mild illness need to stay home, and really need to make sure that those who are well or even with mild illness do not come to these testing sites and potentially expose themselves to those who might be positive. We are starting to, as I just said, we're starting to identify positives. So there are going to be some folks who are positive that show up at some of these testing areas. And for the safety of our community and for the individual, we need to make sure that those who are well and those who have mild illness, please do not go to these testing sites. And the testing sites are taking precautions to make sure people are protected, but keeping in mind that in terms of risk, the testing sites, healthcare facilities are where sick people tend to go. We want to make sure people are protected.
This is
Bruce. There's no number on the local testing yet.
Let me clarify a little bit. I think the issues on what types of testing are being done. We have the testing that we at the state laboratory do on persons under investigation. These are individuals typically that are seriously ill, who have an exposure history that would warrant testing. And after the flu's been ruled out, we've tested about 30 or 40 individuals over the last few weeks, and have found at least a dozen or so to be positive. Those are the confirmed cases that we've previously reported. What we're seeing now is a lot of reports from the private labs. That's another category of testing. As Dr. Park pointed out, there are hundreds of tests coming in now from the private labs, and we're evaluating those results. Any positives that are identified through the private labs are considered presumptive positive tests, and we act as though they were positive, but those results are confirmed. And then finally, the third category of testing that we're doing is also being done by the health department, but that is being done under this Sentinel surveillance program. We have recently reported on the first of 62 samples that were collected randomly across the state, and none of those individuals were positive, which gives us a sense of whether or not the disease is widespread in the community. We're going to be testing another 200 or so this coming week. So altogether, we'll be looking at a fairly large number of cases, or excuse me, large number of samples from around the state, with some oversampling on Molokai and Lanai, some areas that we normally wouldn't expect to see a lot of results. These are individuals who have submitted samples for respiratory disease, and we're evaluating them for COVID-19 in addition to, of course, for those to test for those other, for the flu and other respiratory illnesses. So the results are, when you just ask a simple question about testing, it really depends on what category you're talking about. But what I expect we're going to be reporting a lot more of over the next few weeks at least is a testing done by private laboratories. There are three private laboratories doing this, DLS, CLH, and Kaiser.
Well, Kaiser's still pending, so it's really DLS and CLH at this point.
Yeah, so excuse me, two private sector laboratories. Those tests are being done on the mainland. We have about a 3 or 4 day waiting period between when the sample's collected until we get results, or until the provider gets results on those tests. So there is a lag in our getting the reports. We receive the results just about the same time the provider does. So in many of these cases that we're going to be reporting to you, we know very little about the case. The provider may know as much as or more than we do, and we have to follow up, of course, and collect that information from the individual who was tested positive. So we're in that process now on today's tests. That is the 4 that were mentioned earlier in the report here. And by the way, of course, those 4 are the cases that have been reported since the last time we reported, which was about a day ago. So we're keeping a tally on those now, but we're going to be seeing a lot of doing a lot more testing now, and of course we're going to see probably an increase in the number of positive tests, both because we're doing more testing, but probably more importantly, we're starting to see the disease more often occur in Hawaii through travelers and others who may have been coming into contact with cases. As you all know, this virus is spreading rapidly through much of the U.S. In fact, most of the U.S. now have cases, and in many areas we have community spread. So when that happens, you're going to see a dramatic increase in the number of cases, and we expect that to happen eventually here in Hawaii. As far as we know, we don't have any widespread community transmission here in Hawaii. The most recent Kualoa case, which has been of interest, was a situation where an employee, a tour operator, tour guide, became infected, probably because of contact with a traveler who was visiting the ranch. They have literally hundreds of individuals taking tours and participating in other activities at the ranch. And it's very likely that individual came into contact with a person who was infected. That individual, in turn, it seems, may have infected other household members. We had 3 people reportedly ill and had been sampled as of yesterday from that group. My understanding is the rest of the household members will be tested, but only 3, as I know it, were positive. That's really not widespread community.
3 weren't positive, and 3 are being tested. The others are asked to stay in home quarantine. And on that, I'm just going to interrupt here and just say that reminder that those who do not have symptoms should not be tested. And for everyone to consider the fact that for every person who is tested, that is burning through our supplies, the testing supplies, it's burning through the PPEs. there is a critical national and even international global shortage for the personal protective equipment that is really critically needed for our healthcare workers. So we want to be mindful of judicious testing. It's why the Department of Health has been very focused in our testing to be careful so that our supplies can be spread out over this marathon of this disease, this pandemic. And so really trying to make sure everyone understands it's for our community's health, to make sure that healthy people and those who are mildly ill do not seek testing, that if you're mildly ill, you stay at home, that unless you have an underlying condition or you're older, in which case you should call your doctor for advice. And to also consider that, to not seek testing for the fact that it's, again, it's to protect yourself from not being exposed in those testing sites potentially if you're not already infected. And number two is to not use up very precious PPE that could be redirected to our healthcare workers to ensure that as this marathon continues, our healthcare workers are protected so that they can take care of us.
Good. Colleen from the Maui News.
Oh, hi, can you hear me?
Yep.
Okay. I want to ask about the latest Maui case, but is that all you know? Like, you don't know if it's
Unfortunately, that's all we know. All of these are adults, by the way. That's the extent that I can tell you right now. We're just as anxious as you are to get more information.
Okay. Let me ask then about the second Maui visitor we had who recently tested positive. Do we know where they're from and where they stayed on Maui?
The second one, I believe the one that we announced the other day, my days are blurring together, but the one that was the flight attendant from Canada?
The one after the flight attendant.
The one from Texas.
Oh, is that where? Okay, because we didn't have a location yet or where they had stayed.
That one was from Texas. That state is aware.
Okay, and do we know where they stayed?
I'm not sure that that's been. Okay, Janice will follow up with you guys.
Okay, thank you.
Colleen, we'll try to come back to you. Robbie from Honolulu Magazine.
Hey, Robbie, did you have a question for us?
Are you on mute?
Remember to *6 to unmute yourself, Robbie.
I know she was there.
Hi, on the total, can you guys hear me?
Yep.
So it's now 14 presumptive positive.
I think it's actually 3 confirmed now, if I got my math together, and 11 presumptive positives. Is that right? I'm looking at Myra to help me. Yeah.
Now that we're not having to send samples to CDC, these are all confirmed positive.
Anything tested in the state lab is considered confirmed. We have an agreement with the commercial labs to at least confirm the first few specimens that they test to make sure that we can actually call them confirmed. So they're still considered presumptive positive until further notice. The challenge for actually calling them confirmed from the clinical commercial labs is right now they're sending out to another facility on the mainland, and so they have to grab that specimen if they didn't split it before they sent it.
Robbie, we're putting up the number of cases confirmed and otherwise on our website. We're planning to launch that tomorrow, and one of the things we've decided to do is to try to keep you all up to date on the numbers and accurately then post what we have in the various categories that we talked about, so there isn't a lot of confusion.
Actually, it's on our.
It's on.
So on the Kualoa case, do you know how swiftly you would expect to know about the other family members?
As I mentioned earlier, I only know what I saw on the news last night, which was that the physician evaluating the situation had taken samples, and I'm anticipating they would be sent to the mainland for analysis and would take another
No,
couple days?
the ones that are, again, reminder that those who do not have symptoms should not be tested. We obtained specimens on the ill family members. I believe they are at our state lab and are being run
That's what I was
right
talking
now.
about.
Yeah, so that's what Robbie's talking about. Just going back to the case counts, just to let you all know, the case counts are being reported on our website as of yesterday. And just so you all know, obviously this is a constantly fluid shifting sort of situation. So just to make sure there's no confusion, the counts are always going to be up to date as of noon for that day. So there may be new cases that come in during the day, but just so you know that they're showing the counts for that day as of that day at noon. So hence, if you looked right now at our website, the Disease Outbreak Control Division website, you would see that the count in total is 13. That's because, as I just stated, we were just apprised about the 14th one. So you're getting hot off the press the 14th one, and that's why I don't really have any information on that one at all.
Okay. Let's go to Max from Big Island now, please.
Okay, here we go. It's Max from BigIslandNow.com. My question is, does the state currently have any plans to mandate the closures of restaurants, bars, and gyms, and are you advising the governor that that would be prudent to do, immediately?
I'm pleased to see that the private sector has taken initiative in a number of situations to close their operations. Some are running a takeout service. Others have closed down completely, depending on whether they can find that to be viable. There is no order at this point or recommendation to close, but I believe that most private sector operations are doing so. Of course, government operations are essentially closed. All the schools are in recess, and some of the cafeterias and so forth are still serving food, but
As a grab and go.
But it's a grab and go situation. Our recommendation is of course that the restaurants resolve any uncertainties in favor of protecting public health, and that they consider discontinuing their any operation where there may be individuals gathering, eating or waiting for food. Again, as far as I know, there's no direct mandate for that at this point. I believe that most are taking those actions voluntarily, and we're certainly encouraging that across the state.
Okay. Before we go to follow-up questions, did anyone come on the line late who hasn't had a chance to ask a question? Okay, hearing none, let's circle back around. We have about 12 minutes. Lisa from Hawaii News Now, you get a second question.
Hi there. I know that you said you're still gathering information on the Maui patient, but I just wanted to confirm that people should be able to get the test even if they do not have insurance, because I heard that the patient went to Maui Memorial but was not tested because they did not have insurance, and another doctor tested him, and that's how the positive result was found.
I cannot comment on what happened. Again, I have no information, so I can't even confirm that or
No, as
correct
you,
that.
You
But as far
still
as
get a test even if you don't have insurance, though.
Yeah,
Right.
Yes. No one is going to be turned away from hospitals or not tested because they can't pay for the test. Most of the health plans have been contacted, and they will cover the cost of the test, and if the individual can't cover the copay, that will be waived. That should not be a barrier. But as pointed out earlier, any individual tested should be consulting their physician before going down to be tested. Only those who are symptomatic and who have a physician referral, an official order, would be tested. We don't want to have people unnecessarily tested. We have already scarcities of supplies, swabs, and other materials that are being used in the testing program, and we don't want to exacerbate that. Those materials are needed to focus on supporting services to the elderly, to individuals who are high risk, and of course those who are seriously ill. So people should be aware of that before they go to any of the centers there. The centers were established essentially to reduce the volume and not to flood the emergency rooms, mostly with people who are
Sick.
not sick, worried well. We have lots of people going to be tested who are not symptomatic, who are just concerned that they might have been exposed or may have been ill months ago. Those individuals should not be going. It's a waste of their time, and of course a waste of resources to do any testing on those. And most of those are being turned away from
And it puts
those
themselves at
facilities.
risk.
And again, the individuals are at those centers at risk. There are very probably, or more likely, others who are infected who will be going to those centers. So it's best just to stay at home, avoid people as much as you can who may be ill, and certainly not to needlessly stress our somewhat fragile medical resources.
I think it's important for everyone to understand that testing will not likely change how you should be managed, how you should be clinically managed by your provider. You'll still get the same advice from your provider: stay home, rest, take lots of fluids, keep a close eye on your health, and if you get worse, if you develop difficulties breathing, if you have persistently high temperatures, then call your healthcare provider, or especially if you have difficulty breathing, call 911 and let dispatch know about your situation. I mean, that would be the standard advice, whether COVID-19, frankly, or anything else. And so what I think is really important for people to understand is where it really makes a difference in terms of who we know is COVID-19 positive or not is those who are seriously ill, because it's the seriously ill where they might be a candidate for us to enter into a study of the study drug remdesivir. That would potentially make a difference for those people. In addition, for potentially like a healthcare worker who maybe is treating a medically fragile population. But even I would say that even for some healthcare workers, wouldn't necessarily test, or the testing wouldn't make a difference, because frankly, we need to make sure that whether you have any kind of infection, if you are ill, you should not be exposing others, and you need to keep those germs to yourself and not share them with the community.
Thank you. Dan from the Star-Advertiser?
Yeah, thanks, Dan. Hey, Bruce, now that we've had this case at Kualoa, what would the recommendation be for tour operators as well as visitors who might want to be taking these tours?
Our general recommendation would be to avoid groups and gatherings, and that would include tours where people come into close contact with one another. Most of the tour operators have canceled their tours across the state, and we certainly encourage that. We have some general guidance that people avoid or not have any gatherings or events that include more than 50 people. The president came out today or yesterday with a pronouncement that people who should not any events that have more than 10 people should be included. We could pick almost any number we wanted in that range, but let me say that the most important thing is to encourage and to support social distancing, staying away from other people. The disease is transmitted from person to person, and if you stay away from other people, you won't be transmitting the disease. So that is the most critical factor, the one that we're emphasizing more than the numbers. But people are asking for a number, and right now the number that CDC has recommended, which we've adopted, is 50. That number very well may change in days to come. But again, the important thing to remember is that what this is for, and that is to keep people apart so that we don't transmit the disease from one person to another. Mm-hmm. And that's, I think that's key. And I wouldn't worry about whether you have 12 people together or 20 people together. It's important that you not be in a situation where you may be transmitting the disease to someone else or vice versa. So stay tuned. That number may be changing locally and internationally again. But the best guidance we've put out so far, and the most clear guidance, is available on our website. But that is that any gatherings or events of over 50 would be highly discouraged, and we'd recommend it in all cases, regardless of how big the gathering is, that people maintain social distancing.
Okay, Hawaii Public Radio, please.
Hi, this is Casey with HPR. You did mention that you believe that the private sector is doing enough as far as restricting how many people come in, and I guess also with the retail side of things closing down. But I was just wondering, what would you consider, I guess, mandating bars to close and for restaurants to close? What would you consider? What would have to happen in order for you to mandate that?
We obviously would need to identify some criteria on which to do that. I think many of the restaurant and bar owners intuitively have a feeling for what crowding is, and most have stopped their activities. Obviously, we could apply possibly the 50-person rule, but I think most have gone much further than that. I know Starbucks, for example, has stopped has ceased all operations except for takeout, and most restaurants are in the same boat. There are some restaurants that probably could accommodate social distancing and how they place their chairs and tables and so forth. I think it's been recognized by many that people in the state and others are dependent on largely dependent on the food service industry to provide meals, and those are being provided to some extent through takeout. But we'll I think need to review that situation and make decisions. We're not yet in the situation they are in New York and other states in that area where they have seen widespread transmission, community transmission. I think we need to be proactive here and to prevent that, of course, and the sooner that's done, the better. Most people are recognizing that here. And again, so far as I know, the compliance has been very good, and the private sector has actually taken steps to close or to dramatically reduce the potential for exposure. So I'm very, we should be very pleased that has happened here in Hawaii. That's not happening in other places as much. People in the bars are ignoring the recommendations, and if we get to that point, we may need to take further actions, including mandates.
Okay, Casey, thanks. And final question from Alina from Civil Beat.
Hello, can you hear me?
Yep.
Hi, yes. I was wondering if you could talk about the possibilities of expanding our hospital capacity.
You know, one of the problems that all states deal with is that the hospital capacity is close to maximum, even under normal circumstances. No hospital can afford to operate with lots of empty beds, and expanding hospital capacity is a very difficult task. We actually have begun to look at options, should we need them, of accommodating additional patients in non-hospital settings. Obviously, we'd like to try to maximize the existing spaces in the hospitals, and they're looking at how they might do that, and we're trying to support that. We've considered waiving some of the requirements that often take months in order to get approved redesign of the hospitals to enable that to happen quickly, and we will continue to support that. But the Hawaii Emergency Management Agency is aggressively looking at the hospital systems. The Hospital Association of Hawaii, which oversees all the state hospitals and long-term care facilities, is also looking to see how they could expand their capacity quickly. We don't have time and probably the resources to build new hospitals in the short term, but we are looking to utilize other facilities and to maximize the existing spaces that we have.
Okay. Dr. Anderson and Dr. Park, thank you very much. And sorry to those of you who didn't get to ask a second question. Of course, you can write hawaiicovid19@gmail.com with any follow-up questions. And we'll plan to try this again tomorrow at 1:30, I believe.